My name is Courtney. I'm the Executive Director of HEPPAC, which stands for the HIV Education and Prevention Project of Alameda County. This in the background is one of our many vans that we have dispatched out in the community that does mobile harm reduction services. This is our smaller van where we can hit a couple corners a little easier than when we have our big RV out. But today we're going to talk about exploring what's working and where change needs to happen as it relates to mobile services for SSPs. So let me see. Are you able to advance screens? I'm having some issue over here. There we go. Yeah. So one thing is combating the stigma associated with accessing SSPs. So just for folks to even show up sometimes is a barrier because it could be associated with a certain kind of stigma, whether it's from their peers, their family, on-seers, people walking by, whatever the case may be. So just the fact that when people show up to wherever you're at, acknowledging that, hey, who knows what it took for you to get here, and just it's a strength. It's like we always try to play up people's strengths-based approaches. Like you in your stage of whatever use it may be chaotic, you knew to come to the syringe service program and get access to whatever it is you need. Of course, we have a plethora of services. We're an integrated service model. We do HIV testing, Hep C testing. We have a doctor there, access to meds, so on and so forth. But sometimes folks literally just come to get some food. And we know food is a gateway to get other services. So even though a lot of our contracts are to make sure we test people and make sure people know their status and make sure we're doing this and make sure we're doing that, all the things that funders want us to do to be impactful in the community, sometimes just being present and having that community there, folks just want to get something to eat. They just want to have a talk with somebody. They might not be ready to do the testing or see a doctor. They got to get to know you and trust you first. And then sometimes just even getting over the fact that they're at a syringe exchange. A lot of folks are so used to being in these FQHCs, and that is how they know medical checkups. And now that we're doing more mobile medical, this has become a standard for a lot of our participants. And when you ask people who's your doctor? And they'll say, oh, HEPPAC's our doctor. And I'm like, well, HEPPAC isn't a medical facility, right? We are a nonprofit CBO who does syringe service programs, and we connect with other people who are medical facilities who come to the streets, such as the agency Roots Community Clinic, Trust Lifelong Clinic. We work with Healthcare for the Homeless and so on and so forth. So a lot of folks we see have not been to what we would call brick and mortar medical home in a long time, and they prefer to actually access medical services at these venues where we've set it up throughout the community. The great thing about that and some of the feedback we hear from our participants is that we're bringing services right to where they're at. And so that is in the trenches, as some people call it, on the track, near encampments, in areas where a lot of folks are convening, and things of that sort. I sometimes go off on a tangent, so just excuse me, because I just love what we do so much and I just have to tell those stories. But addressing stigma is definitely one of the first things that we want to interact with clients about, is just letting them know hey, what are you dealing with and how can we help alleviate the stigma? We can move the next slide. Let's see if I can do it. Oh, here we go. Oh, let's go back. All right. So we like to talk about the harm reduction spectrum in harm reduction, because a lot of times we will hear from people who, what we say, are not drinking the Kool-Aid, that harm reduction is encouraging or promoting drug use. The reality is people are going to do what they do, right? There's ambivalence of drug use in itself. There's things that are great about drug use. They make you feel good. They alleviate pain. And then there might be some things that are not so good about drug use, like the drama it could cause with your family or how it negatively impacts your health. So when we talk about the spectrum, we're talking about possibly someone who would be considered in a chaotic stage of use, where everything and anything they do is related to getting that drug, and everything around that they may put in jeopardy around that. And then we have the whole other side of the spectrum, right? Which is abstinence. You know, we don't necessarily live in an abstinence world, but abstinence is in the spectrum of harm reduction. And for some people, abstinence is the most effective way for them to address their drug use, address their health, address a lot of things. So we like to work in that setting of, you know, this complex harm reduction spectrum, and acknowledge that when people come to us, they're in all different kinds of variety of that spectrum. And our job as providers is to kind of identify where it is you want to go. And we're just the navigator, right? We're going to help you get there. We're not here to tell you to stop using drugs. We're not here to say that you should or shouldn't be doing something. What you need to do, all those are words that we stay away from. Is how can we help you? How are you surviving? How are you staying safe? Like, you are an expert in your own life. If you are in your chaotic stage of use, and like we said, you showed up to the exchange on a Tuesday night, 5 minutes before we're about to close, hey, that's a strength right there. You knew to come to us to get whatever it is you may need. We know that people don't always live by our time frames that we give them. And, you know, the exchange is 6 to 8. We need you to be here on time. And there's plenty of time where people show up 2, 3, 4 minutes before we're about to leave. And staff kind of already know the situation. Like, there is going to be a certain time where we may have to like stop because we have to acknowledge that we're here for a certain time. But we work with folks. We're like, okay, we're getting ready to close. What can we get you? And we move forward from it. We just like to, you know, understand that drug use is a complex, multifaceted phenomenon, and chaotic use and abstinence are on those spectrums, and to just really acknowledge where our participants are at in that and help them to the best of their ability. Some folks really don't want to stop using drugs, and that's okay. It's just like, how are you surviving? How are you staying safe while you're using those drugs? What are the good things about it? And what are the bad things that you want to work on about it? Utilization in non-clinical settings. So this picture here is back in the good old days when we used to have our medical providers doing medical work on the RV. This is pre-COVID. So now that COVID is in the picture, we do it a little bit differently. So we had to adapt when COVID came, right? We kind of halted specific services and just did our core services, which was syringe service and overdose prevention. But like, even the medical providers had to give it a stop halt, because we want to make sure that we were adhering to infectious control measures when dealing with public and things of that sort. And so now what we do is we pop tents on the curb, which is kind of what we used to do back in the day before we had an RV that was all tricked out with a medical component in the back. But it's about really just being able to find the way to provide the service. So once we realized that COVID was here, and now we have to have these face masks and all these gloves and these gowns and 6 feet, and people got to be temperature checked, and people have to sanitize their hands, like, all these things are also barriers. And we had to work with our participants to say, hey, this is the new standard, and know that it's not always going to go as smooth. Like, some folks are like, I'm tired of wearing a mask. We're tired of wearing a mask too. And this is the way that we have to interact with you. And we would love to give you daps. We would love to give you hugs. We love to be close to our clients. And when COVID came, it was kind of like we had to have this stiff arm. And this is not how we do business, right? We're compassionate people that like to be close to our participants, and like, they're in our face and we're in their face. And now due to COVID, it's kind of like we have created this barrier. But in that, we had to just also find ways to still be able to provide the service. So, you know, normalizing that you're going to be having to wear a mask, and kind of making it a routine. Like, hey, just how you're sanitizing your hands, I'm about to sanitize my hands. This is all going to keep us safe. So at our drop-in center, what we did was we didn't stop services, but what we had to do was do what we call door service. So instead of people coming in, being able to take a shower, do a load of laundry, just have a sofa to sit on for a minute, it sucked that we had to stop that. And we had to say, hey, you can come to the front door. We can give you, you know, PPE and food and all that good stuff. We even set some chairs outside if you just want to have a seat. But those were some things that really sucked for our clients, because our services are their services. They take ownership over the syringe service programs, whether it's in the street or it's at the drop-in center. And a lot of them complement each other. People who come to the drop-in center find out about the mobile syringe exchanges, and people at the mobile syringe exchanges find out about the drop-in center, and they act, you know, accordingly with each other. Being in mobile settings is kind of unusual for some people, because they're usually just going to a brick and mortar. And now that it's becoming more normalized, people are really like enjoying from what I'm seeing and like accessing more because it's in the streets and it's in these settings versus like having to go to Highland Hospital or having to go to your brick and mortar. It's like, hey, I can go to the Exchange. If I want to see the doctor and they have space for me, I can see my doctor, or I can just go and get some condoms, some sterile syringes, and, you know, some food. And so it's interesting that asking some of our participants, you know, what was your frequency of going to the doctor? Sometimes it wasn't even once a year. But when you're talking about having medical and non-clinical settings, like out in the streets, people would see their doctors actually more. So we're talking about 3 to 4 times a year, which is a significant increase from like either not at all or, you know, once a year. And a lot of people that we were talking to, the times that they did go to the medical doctor was when the emergency room, when they had like a severe situation, a severe medical situation. And, you know, for us, I'm like, well, that's kind of not sufficient. You know, it's like, I'm only going to go to the doctor when it's that much of a health emergency, when these access to medical should be something that is more familiar to people and something that's more routine. So that's why we love being able to provide medical services in non-clinical settings, kind of as an integrated service model, because it's kind of like a one-stop shop. Everything is there. You can go there and talk about anything you want to talk about. If you want to get linked to Matt, that's great. If you just want to have a discussion about what that could possibly look like, you know, if you were to get linked to Matt, there's no pressure. The only pressure is just, hey, let us know how we can help you. And then playing up on people's strengths. What did it take for you to get here? It's really important that we really have these conversations with participants because they are the experts in their own lives. So it's been proven effective. I mean, we all have the data, right? People who access syringe service programs are more likely to get tested. People who access syringe service programs are more likely to seek medical care, more likely to just have a better quality of life because they're getting access to these one-stop shops when traditionally they were not seeking this in their medical homes. It's a strengths-based approach. Like I said, how are we surviving? And it's an alternative to systems that were not impactful for them. So we used to hear a lot of stories of participants who would go to their medical provider and they wouldn't be able to have open dialogue around their drug use versus the medical provider telling them just to stop or getting them into drug treatment, which is for them sometimes just abstinent, versus, okay, when you're injecting, how is that going for you? How are you preventing from getting abscesses? How are you rotating out your veins? Like these questions and these conversations are not normal for some people in medical settings, but it's very normal at the syringe exchange. We get to talk about, you know, the drug supply. We talk about, you know, people have witnessed overdoses and or what was their reaction when the overdose happened? Did they feel like they were fully trained? Did they feel like they had all that they needed to have in order to reverse somebody's overdose? Of which, you know, HEPAC does that as well. We go into the encampments and train people who are active users. We also train other agencies who see people who are active opiate users so they can be first responders. And then we also work with agencies so they can be distribution sites themselves. So it's an extension of the service. So if HEPAC's not open, you can go to the liquor store over here who's been trained and you can actually get Narcan for free at various locations throughout Oakland. So we definitely pride ourselves in extending our octopus arms of Narcan and education and syringe service programming so that people know that even when we're not in the streets, you are this close to getting what you need. You can get the Narcan, you can get condoms and things of that sort. Let me forward here. Okay. So harm reduction is for Black, Indigenous people of color. We work in communities of color. A majority of our participants are Black, Latino, persons of color, I'd say at least 80%. And that consists of the people who access the 3 fixed syringe exchanges in Oakland, and the people who access what we call mobile services. So even though it's all mobile, we're all out in the streets, we identify fixed as a site that we're at for a specific amount of time, no matter what. So we always like to say rain, sleet, or snow, we're out there, and even on holidays. So every Tuesday, 6 to 8, every Thursday, 6 to 8, every Friday, 11 to 2. So, you know, routine becomes something that is familiar for people. And they're like, hey, I know this place is going to be open for me. Then you have what we like to call mobile services is where we kind of go off into emerging encampments, or some of those encampments who have been around for years. Like, as you guys live in Oakland, know that the Home Depot over there, that's been around for at least a good year. Before, it was right across the street from Home Depot. It was under that High Street bridge that is now gated up. But going to these mobile sites is really important because it filters people who do not access the syringe exchange, to let them know that, hey, yes, we will be out here based on demand and our capacity, because there's so many encampments we have to hit, but you can definitely come to the syringe exchange every Tuesday, every Thursday, every Friday, and or the drop-in center. It's a good place for us to talk about race and how it plays a part in people's use and being racially profiled, things of that sort. We have a new program called the Black Drug Users Health Hub, which educates people on the war on drugs and how it has impacted people of color, and then invites people into the network to be able to access services that is relevant to them, that is from people who look like them. And, you know, we want to be able to talk about the variations of drug use. I mean, there's street politics. Like, you can't go to certain parts of town and cop dope from people because the dope might be bad, or there might be some kind of gang wars going on. And it's just all kinds of street politics and things going on within Oakland right now that we have to be privy of. We have to have this information. We have to have open dialogue. HEPAC's been in situations that have threatened the lives of our own staff. And because we have such a tight communication and respect with our community, like, we were able to leave situations unscathed. We're talking about shootouts, guns being pulled out on, you know, people, and our clients are like taking care of us. And there's a lot of self-governance that happens. Like, if there's fights breaking out, usually folks will break it up themselves, because they know, like, hey, if you mess this up for, you know, all of us because of this fight, then none of us are going to be able to get services, because our first and foremost thing is the safety of our staff. So if it's really going down, like, we will stop services, we will leave. Like, we have to take care of our staff first. And then just harm reduction for BIPOC communities, it's not what we do, it's how we do it. This picture down here that you see is Denise Lopez, was a previous harm reduction services manager, and she had an awesome rapport with participants in the community. And then you see Mike Snow, he's no longer with us as well. But every time someone comes to HEPAC, they leave a little bit of something before they leave on and go do other great things in the world. So we were just fortunate enough to have both these two who, there's a new crew who will probably be in other pictures and other presentations in the future. But yeah, we pride ourselves in definitely hiring people from the community, hiring former participants, and then building their development so that they can give back to the community. That's really important for us. So we're at consistency is key. This picture is back in the good old days when I was doing direct services testing in the back of the RV pre-COVID. And just being consistent is so vital to the work that we do. And that's why I love our fixed sites, because rain, sleet, or snow, even on holidays, we are going to be out there, because we know HIV doesn't stop because it's Christmas, and you know, overdose doesn't stop because it's Thanksgiving. Like, we have what we call skeleton crew, so we don't have as much staff out on those like specific holidays and other days, but we are out there, rain, sleet, or snow. And that is what's so important for the community to see. And that's what's helped us be so successful and being able to be impactful in the communities. People know, hey, they're going to be out there. I don't care if I show up late. They're not going to judge me. I can go there, I can get food, or I can go there and get a full setup for me to be able to use my drugs safely. Strengths-based approach. This is just so important. I keep talking about it. It's like, everybody has a strength. If you have been surviving and using drugs, like, there's a strength in that. What has it been? How do you stay alive? How do you stay healthy when you're using drugs? Like, that's the conversations we want to have. Like, when you're realizing you're, you know, injecting, like, what is your measures? Are you making sure you wipe with the alcohol prep? Are you making sure the bevel is correct? Are you making sure that you have enough syringes to get you through the week and that you don't have to share? And what if you do have to share? You know, what is going to be your method to make sure that that syringe is going to be as sterile as possible if for some reason you cannot access the exchange or no one has any sterile rigs on site? But we want to make sure that we give people enough that they do not have to share at all, and that we actually encourage people to use one syringe per each injection and not reuse them again. And then we just welcome you to the network. So whenever you show up to HEPAC, it's just like, welcome, you are now part of a network. And that's what this means. You can have access to this, and this. And HEPAC collaborates with a lot of other agencies. When people from the outside come in, they just assume HEPAC does it all, and it may be true in that sense. But like, we collaborate with other agencies who provide the mat, because we ourselves don't provide the mat. We collaborate with agencies that provide the medical, because we ourselves don't provide the medical. It's just about having those strong collaborations is so important to having a robust program that really will serve the participants and make it that one-stop shop where they can go get anything and everything that they need.